We are pleased to have Dr. Stanley Allen and Ms. LeAnna Matsey join us to talk about managing headaches after aneurysms. Dr. Allen is a physical medicine and rehabilitation physician who specializes in brain injury. He has been practicing for 12 years and working in inpatient rehabilitation for 8 years. Dr. Allen has been with the TriHealth Rehabilitation Hospital for 3 years, and prior to working in the tri-state area, he practiced in New Hampshire. LeAnna Matsey is an occupational therapist at the TriHealth Rehabilitation Hospital. She has been working with brain injury survivors for 16 years. LeAnna also volunteers on the board of the Tri-State Brain Aneurysm Support Group as a liaison from TriHealth Rehab to the community. Thank you both for being here. You may now begin your presentation.
Hi, thank you very much for having me. I thank all of you for signing up for this webcast and joining me here for this lecture on managing headaches after aneurysm. So when I was asked to put this presentation together, I did a little bit of thinking as to the types of patients that I had seen after aneurysm, and we frequently see patients after aneurysm or brain bleed that do complain of severe headaches, and it wasn't clear to me exactly why this was, so I did some research and found that this is a significant problem in the community of post-aneurysm survivors, and that about 20% of people who survive a subarachnoid hemorrhage from aneurysms do have a persistent headache that significantly impacts their quality of life. Looking through the research, there isn't a good explanation as to the etiology. Some researchers believe that this is related to persistent neuroinflammatory response that continues after the injury and is a maladaptive type response. Something that is not constructive or helpful for the body, and can be quite a problem for patients. And this would be a separate type of headache from other headaches, but can present in a similar way to migraine and other types of headaches. So let's move on to what we want to accomplish in this lecture. I wanted to talk to you, to this group, about coping strategies and give you strategies that can help you manage your headache as you're getting through this. And but we also want to look for warning signs of any problems. We don't want to be ignoring anything that might indicate a neurologic progression. And then how to talk to your doctor about your headaches. It is helpful for us doctors when patients come in and they have specific questions for us, and they know what information to be looking for and how to pay attention to that. And then we'll cover some questions that I frequently run into in headache patients. Okay. This is a acronym that's commonly used in management of headaches, and I think is a very good general guideline when you're thinking of how to manage your headache. Start with SMART. You can the S stands for sleep. You want to make sure that you get regular and sufficient sleep, that you're maintaining good sleep hygiene, that you're going to bed at the same time, that you're getting up at similar time and getting sufficient sleep. The same thing goes for meals, that you're getting regular meals and sufficient meals, and maintaining good hydration with that. So those first two items, you want to make sure you're getting regular and sufficient. And then you want to make sure, again, you're getting regular activity, but not excessive exercise. Really, consistency in your activity is more key to helping you regulate and reduce headaches than doing strenuous exercise or pushing yourself to do greater amounts. It's really the consistency. And then we want to use relaxation strategies that help us manage stress. Stress is one of the major triggers, as you would know, for headaches. And then you want to identify the triggers for your headaches and then avoid those consistently. Let's move on to some tips for your sleep. I had mentioned earlier getting regular sleep. It's important, again, regularity, developing a ritual of when you go to bed, what you're doing. You're brushing your teeth before you go to bed. You're avoiding very stimulating activities. In fact, exercise can be a problem. Actually, if you're doing really vigorous exercise before you go to bed, that can be a problem. And then you want to, of course, maintain a dark area and a quiet area for your sleep. Don't eat too much before you go to bed. All of these are very well-known, common sleep hygiene strategies, all outlined on this slide, and I think is helpful for everybody to know. You can go through the rest of this slide. I think I'm going to try to move forward here. Okay, in studying this, researchers have found that there's a kind of a cycle, a relationship that exists between sleep and headache, and it's important that you not get into a bad cycle of sleeping too much during the day to offset your headaches and then creating insomnia at night, then making your headaches worse. So try to avoid that cycle and stay on a regular routine for your sleep. Okay, going on to foods and headache-inducing foods. I found that migraine-inducing foods work the same way for almost all types of headaches, but things like a lot of processed foods, things high in nitrates, bologna, hot dogs, and of course you want to avoid excessive caffeine. Too much caffeine can actually make your headaches worse and cause a rebound type of effect. So if you're having a consistent headache problem, and especially a daily problem, look at the foods that you're eating. Okay, and again, this may be a little bit repetitive, but make sure that you're eating regular meals, that you're eating sufficient amounts. Being hungry is commonly a trigger for headaches. Now, as you can imagine, the healthier you are, the less headaches, the better you're going to feel, the less headaches you'll have. So make sure that when you're making any changes, you've identified some triggers for headaches. You want to realize that these habits will take time to develop, and be patient with yourself. And over about 6 weeks, you should be able to develop a new pattern and new habits. It's important to make sure you're staying active, manage your weight, avoid things like smoking or drugs, and then minimal to no alcohol consumption really would be recommended. Again, you want to make sure that you're talking to your doctor about managing blood pressure. Make sure you're avoiding simple carbohydrates, staying active, controlling your cholesterol, eating better. All of these things improve your health. They will reduce the amount of headaches that you're suffering. And then recognize that your symptoms often come in cycles, and you want to avoid the negative cycles that come with symptoms. You may have an underlying disease that creates some pain, and then develops into muscle tension that causes more pain, causes you to feel stressful. Those emotions then develop into other issues like depression, fatigue, and then triggers more disease. So we want to make sure that we stay away from these negative cycles, and recognize that there are positive cycles we can find instead. You want to make sure that you're doing positive things like managing your medications properly, going to all of your doctor's appointments, and managing your symptoms as outlined and planned with your doctor. Again, the American Heart Association, these are the basic recommendations they have. Again, all of these recommendations are repetitive, but these are actually very important points in reducing the amount of headaches that you're having and how well you're feeling. So make sure you're taking all of your medications, work on your stress levels, bringing those stress levels down. And if you're struggling with depression or anxiety, make sure you're seeking help for those emotions, and potentially seeing a counselor if needed. See your doctor regularly, and again, minimal amounts of alcohol. Now, LeAnna's going to talk a little bit later on about these strategies, but we did want to give you guys some strategies or methods to reduce your stress. Reducing stress, again, brings down those muscle tensions that often trigger your headaches. Just outlining them quickly: deep breathing exercises, progressive muscle relaxation, mental imagery relaxation, biofeedback, using music, cognitive therapy, and counseling are some of the great ways to work through your stress. And then there's a lot of alternative therapies that have great evidence, including massage, hypnosis, acupuncture, acupressure, and such. LeAnna's going to talk about this a little bit later on, but your breathing exercises, you're kind of establishing a rhythmic pattern, deep breathing, and visualizing, visualized breathing can be really helpful strategies. Here's same type of thing. Progressive muscle relaxation. There's a slide. Again, LeAnna's going to talk a little bit more about that area. Mental imagery. This is taking yourself to a place or an experience that helps you relax. Biofeedback, you can find counselors and therapists that will help you with this. There are also various devices on the market that can help you with some biofeedback to help you relax and be able to regulate your feelings. Relaxation to music. It's really important to find the music that works for you. A lot of people find music a key part in their relaxation, and you want to find what works for you best. Okay, and regarding counseling and cognitive therapy, it's often a very helpful strategy to talk things through with a counselor, to be able to recognize your thoughts and emotions and how they impact what you do, and what we call your behaviors. Those then work back into how you're feeling and the sensations you're feeling, the pain you have, and recognizing those can be very helpful, and a counselor can help guide you through that oftentimes. Now, I do find that acupuncture is significantly helpful for many of my patients, especially when you have a neck pain that's triggering your headache. Also, acupuncture, kind of in the same line of that. I've actually experienced acupuncture myself and have found it very helpful. So there is actually great research to support acupuncture. So I highly encourage this area in management of headaches. Now, something I do not encourage is chiropractic manipulation. There have been cases of dissections and vessel injuries from manipulation. So I would tend to recommend avoiding chiropractic manipulation for neck pain and headaches. There's good research to support the use of magnesium and vitamin B2. Supplementation has been found to reduce the frequency of headaches, as well as coenzyme Q10. Also good evidence for that. Okay, so moving on to some headache triggers, again outlining these issues. People find that alcohol or drinks frequently do trigger headaches. So things like you want to, in this category is wine and beer, hard alcohol especially, and also in this can be too much caffeine. Stress, we talked about this a little bit. Stress is a very common trigger for headaches. It can lead to a lot of muscle tension in the neck and head and face muscles, which then can trigger headaches. Bright lights and glare, it's important to keep these in mind. Strong smells, any type of strong sensations can help or can trigger headaches. Changes in your sleep and insomnia, jet lag, all of these things can be headache triggers. And also they have intense physical exertion in there that can trigger headaches. Weather changes. Another thing to think about and talk to your doctor about is if you're noticing a headache that comes on with a certain medication. There are certain medications such as that create a vasodilation, such as nitroglycerin, that can cause headache. Calcium channel blockers, those types of medications. There's foods. Again, we talked about this a little bit earlier. Salty and aged foods, things high in nitrates, And then skipping meals also can cause headaches. They've found that headaches can be induced by food additives as well, such as MSG. Better to avoid those as much as possible. Okay, so now let's talk about when you should be concerned about a headache and contact your doctor. I like to use the acronym SNOOP, which you have SNOOP. Look for systemic issues or changes such as weight loss. So if something's going wrong in your system, such as fevers, weight loss, any illness, can be a trigger and something alarming to look for. Also, neurologic issues. So anytime you have a headache that's associated with a neurologic change, I would give your doctor a call. That's something to be concerned about, and you definitely don't, you want to ensure that those neurologic issues or concerns don't become ongoing, progressive, or permanent. Onset. So this is an important factor in your headache. So if your headache is a sudden onset, what they refer to as a thunderclap headache, that's always alarming. And then the other O would be for headaches in older individuals, or a new headache that has developed something that's different, that wasn't there earlier in life, is something to keep an eye on. And then progression of the headache, and I would add in there the severity of the headache. If it feels like it's progressively severe and impairing, then that would be something to talk to your doctor about. So when you talk to your doctor, realize that he's going to be looking for these triggers and these exacerbating factors, and be looking to give you advice on how to minimize these. So you want to try to minimize these and work with your doctor in doing that. And we're going to try to do everything we can to manage your headaches without the need for a drug, for pharmacologic intervention. And if we do look at a medication, it's going to be, we would want to do it in a stepwise approach. So we would make, one addition or one adjustment to your medications at a time. So you do have to be patient. And the reason for that is you want to be careful and cautious, and you want to be able to assess the results or the change that you made. Okay, more tips about talking to your doctor about headaches. Look for, when we're talking about a pharmacologic intervention or a drug, the addition of a drug, make sure that you are considering the risk. If your doctor doesn't tell you right out what the risks are, make sure you ask him, what are the risks of this medication? What are the things I should be looking for? What are the potential benefits? Is there a large upside to this medication? And then something people don't often miss is whether you can afford this medication. Is it going to be something that's too expensive? And it's important to write down all of these points when you're talking to your doctor, and give you there a list of things that you should be writing down when you're talking to your doctor about adding a medicine. And then make sure you're following all the advice that you get from your doctor. Talking to your doctor, you may want to know about the different patterns of headaches that we frequently see, even though there may be different causes of headaches. They frequently fall into these, I would say, 6 typical patterns. And going through these, you have a TMJ type headache or a temporal headache on the sides of your head. A sinus headache would be more facial or frontal in nature. Cluster headaches are typically behind the ear and are fairly dramatic. That may actually be they may come with other issues and may come and go quickly. The tension headache is the most common type of headache. Is a band-like headache that goes around your head. Frequently feel like a vice that's going around your head, and again, it is associated with that muscle tension and tightness. Okay, migraines. They can be associated with visual changes, but again, please let your doctor know if you're having visual changes or any type of neurologic change with your headache. Nausea. Migraines classically are one side of the head, but this is not always the case. And then the neck pain, you have pain in the back of your neck, and you can kind of feel it being triggered by the muscle tension there. Okay, and then the other, when your doctor is talking to you about medicines, there would be, there's strategies of interventions that work on the headache when it's happening, or you would take this intervention or medicine when you have a headache, and only when you have a headache. These would be termed abortive medications. Typically what you would think of as taking a Tylenol when you have a headache. But there's also prophylactic medications, which are interventions that you take on a regular basis to prevent the development of headaches that potentially could be in the future. So it's important to keep in mind that difference. Your doctor may write you a medication that that he wants you to take only with a headache or only when it comes, and may not even want you to take it if you don't get a headache to take that medication at all. But there may be there are medications that he or she may prescribe that he wants you to take on a regular basis, even before you get a headache, to prevent that from happening. So it's good for you to know that terminology going in and talking to your doctor. Other contributing factors to headaches to keep in mind are you can get headaches with sinus infections and sinus congestion. Again, we've talked about muscle strains and muscle tension. So if you're coming in with a headache after a car accident, that's something dramatic that you want to definitely go see your doctor about. Could be related to your neck strain. You want to make sure it's not some other worse injury. Also, something to talk to your doctor about would be if you have sleep apnea. If you're waking up with a headache in the morning, that may be something your doctor would need to consider. Dental pain and TMJ pain related to grinding of the teeth at night, that can trigger headaches also when you wake up in the morning. Okay. Did you want to cover relaxation before we get to frequent concerns, or you want me to cover this?
It's okay if you want
I'll
me to
go ahead. Yeah,
okay.
I can go ahead and cover this last slide before we turn it over to LeAnna. This is probably the classic question that we get. When should I call my doctor? So it's important to know, and I don't think I'm being too repetitive, to know when something is alarming. And again, you want to look for when a headache is sudden and severe. Those are times to call your doctor. If you had developed weakness or neurologic impairment, changes in how you're able to move, how you're able to sense and feel things, those are dramatic events that you definitely want to call your doctor about. Dizziness, loss of balance, also that's a neurologic change that is very concerning for us. Numbness, tingling, changes in your sensation again. Trouble with your speech, any seizure activity, changes in your vision, and then anything systemic, rash, fever, nausea, vomiting. If you're feeling sick with your headache, that's important for us to know, can indicate an infection. And then also if it's a new headache, you're not somebody that's had headaches in the past, new, and you're over age 50, that's something to call your doctor about. And then headaches that are triggered by intense activity, or by coughing, sneezing, bending over, any type of positional change that triggered your headache, that would be something to call your doctor about. Okay, I think our next slide will give it over to LeAnna here.
Yeah, I wanted everyone to have an example of a breathing exercise you could do. So YouTube is an excellent resource for looking up exercises or breathing relaxation methods. They also have some specific to headaches. Let's see if this is going to play for us.
Now we will begin some breathing exercises. Begin by settling yourself on your chair, feet flat, back straight, in a comfortable position. If you feel comfortable, you may also close your eyes at this point. Begin by placing your left hand on your abdomen and your right hand on your chest. Breathe comfortably for yourself. Do not try to change your breath. Simply notice how you breathe naturally. Perhaps it's your chest that rises. Perhaps it's your abdomen that extends. Simply notice how you breathe naturally. Now, let's begin to deepen our breath and practice what we call diaphragmatic breathing. With the inhale, we will extend our abdomen outwards, and with the exhale, the abdomen will come back in. We will inhale through our nose and exhale through our mouth. Inhale, exhale. Inhale, expand your abdomen. Exhale, bring it back in. Inhale, exhale, and continue at your own pace for a few more breaths. Finally, we will add a count to our breath. The inhale will be for a count of 4, and the exhale will be for a count of 8. The reason for the longer exhale is that this will stimulate the parasympathetic, or the rest and digest nervous system. As we begin, inhaling 2, 3, 4. Exhale 2, 3, 4, 5, 6, 7, 8. Inhale 2, 3, 4. Exhale 2, 3, 4, 5, 6, 7, 8. Inhale 2, 3, 4. Exhale 2, 3, 4, 5, 6, 7, 8. Continue at your own pace for a few more breaths. The duration of each inhale and exhale is not as important as the ratio of the 4 counts in to 8 counts out. If you need to breathe faster or slower, do what is comfortable for yourself. Now rest your hands on your legs and slowly open your eyes. If at any point during this exercise you feel lightheaded or dizzy, please return to your natural breath until you feel comfortable to resume this breathing exercise.
The next slide talks about rhythmic breathing. So in this type of breathing exercise, if you're feeling that you have the headache and notice your breathing is short and hurried, slow it down by taking long, slow breaths. Inhale slowly, then exhale slowly. Count slowly to 5 as you inhale, then count slowly to 5 as you exhale. And as you exhale slowly, pay attention to how your body naturally relaxes. Recognizing this change will help you to relax even more. For example, you can, as you're breathing in, count to 5. So inhale, 1, 2, 3, 4, 5, then let it out and count it out in your head. 1, 2, 3, 4, 5. And you do it a few times and you can sense that your body is naturally relaxing by slowing your breathing. The next breathing exercise is just deep breathing. So you imagine there's a spot just below your navel, say your belly button, and imagine you're breathing in through that spot, filling your abdomen with air. Let the air fill your abdomen up, then let it out, like deflating a balloon. With every long, slow exhalation, you should feel more relaxed. Breathing deeply and slowly floods the body with oxygen and other chemicals that work on the central nervous system and improve your comfort. The next example is visualized breathing. So you sit in a comfortable place where you can close your eyes and combine slow breathing with your imagination. So picture relaxation entering your body and tension leaving your body. Breathe deeply but in a natural rhythm. Visualize the air coming into your nostrils, going into your lungs, and expanding your chest and abdomen. Then visualize your breath going out the same way. Continue breathing, but each time you inhale, imagine that you're breathing in more relaxation. Each time you exhale, imagine that you're getting rid of a little bit more tension. So there, like I said earlier, YouTube is an excellent resource with a lot of videos that will actually guide you through some breathing exercises. I even, when I was doing my research, noticed yoga for headaches and different stretching exercises you could do to combine with breathing to help you deal with your headaches. And I think they're going to try to send out that YouTube link, but you can also search in YouTube as well. And then finally, we have time for questions. And we've included our email addresses there if you need to follow up with Dr. Allen or myself.
Great, thank you both. And I apologize about the technical difficulties at the beginning of the presentation. We'll correct that in the video that will be posted online so everyone can clearly see a few of those slides that were kind of missed at the beginning. And thank you for understanding. Okay, so we have some questions, and the first one I'd like to start with is, can you speak about painless headaches? What symptoms can they cause, and how can we tell whether we're having a painless headache versus a stroke?
Yeah, so I think a headache, almost by definition, wouldn't be painless. I can see that there can be auras surrounding a headache, so you can have other symptoms, especially with a migraine, that you can have special sensations, changes in your vision, changes in your sense of smell, or just a feeling that you have a migraine that's going to come on. I do see that with migraines. I think that it's best if you're feeling those type of sensations to head them off as quickly as possible. If your doctor provided you with any type of abortive medication or measure, reach for, if you can do some relaxation strategies to help head that off, then go ahead and do those. It's important when you're talking to your doctor to establish a plan of action when you're having those headaches or symptoms. So you want to talk to your doctor about, what do I do when this happens, and then what should we be doing to prevent it from reoccurring, and look at how often it's reoccurring, and if there's other things that can be done to help this keep this from happening. Does that address your question?
Oh, I think that was good. Thank you. There is another question. This is a really good one. It's, a headache can produce anxiety in a brain aneurysm survivor. Any advice about how not to overreact every time we get head pain? Example,
Yes.
thinking that we're having another rupture, but also not to underreact.
Right. Yes, this is a frequent concern I see in brain aneurysm survivors. You're going to have headaches, and the probability that you're going to have another aneurysm rupture is very, very small. So it's important to look for those neurologic changes, and that's why we have things like that SNOOP mnemonic. And I think the key takeaway from looking for red flags and those mnemonics is, if you're noticing a change in your neurologic function, if it's a change in your sensation other than pain, as in your vision, your sense of feeling, or there's a change in your ability to move or function or talk, those are extremely good indicators that that would be something alarming and to call your doctor about. Of course, if it's a sudden onset and positional, those are also another thing that cause us to be worried. And associated with strenuous activity, those type of headaches worry us a little bit more. So if you haven't noticed any change in how you're feeling or your sensation that's other than the headache, and how you're able to move and talk, that's a pretty good check that that this may be a headache that you really don't need to worry about, and that you should initiate relaxation strategies and the other strategies here that we're outlining.
Okay, thank you. This kind of dovetails with that, but it really kind of has to do, and you kind of answered it a bit, but it's, do I call my regular physician or a specialist?
Yeah, so it's important to call your primary doctor whenever you have a concern like this as quickly as possible, and he would be able to kind of run you through a screening process and make sure that the correct people are contacted quickly. However, I would want to say, if you have a sudden change or onset and you're not able to hear back from your doctor very quickly, or things are getting much worse very quickly, then it would be wise to go to the emergency department at that point.
Yeah. Okay, good. That makes sense. Here is another one. Are there over-the-counter medications that can help?
Tylenol is the main medication that we recommend. I do not recommend the ibuprofen, the Aleve, those type of medications without talking to your doctor first. In a patient that has had a brain aneurysm.
Got it.
Tylenol is going to be safe as long as you're staying under that 3,000 milligrams per day, which is on the dose instruction label for Tylenol.
Got it. Thank you. Here is another one. Any concerns with being on medication for a long length of time?
Yes, there are many concerns with certain medications. Certain medications it's fine to be on for a long period of time, and other medications your doctor is really going to try to get you off as quickly as possible. Well, one of the main ones that your doctor is going to try to get you off of would be those non-steroidal anti-inflammatories like Aleve, like ibuprofen. Those type of medications, you can see significant effects on your kidneys and on your GI system, your stomach over time. Other medications, if you're on, say, a narcotic type medication, your doctor's going to want to get you off as quickly as possible. Also, it's very important with certain medications like Fioricet to we start becoming concerned if you're using it for a long period of time and developing a rebound syndrome where you get into a chronic daily headache and have to take it every single day. That's something to be watching for. So again, using the non-pharmacologic interventions as much as possible to minimize your use of medications is really key. Yeah.
And any comments on gabapentin?
Yeah, gabapentin, it's okay to use it for some patients over a long period of time. There are certain patients where I worry about its long-term effects on memory. That would probably be the main one, is I do worry about the effects on memory thinking over time.
Okay. I have another question here that I'm going to ask you, but if you don't feel comfortable answering it, we could always bring this maybe in front of Dr. Ringer or somebody like that to see what they say. But the question is it possible to have a small, slow bleed in the brain without pain? For example, a tiny drip or a micro hemorrhage? And if so, how would we know that we need to seek medical help?
Right. That to me sounds like there's a lot of anxiety here in that patient, but that is a question that's more appropriately addressed by the neurosurgeon.
Okay, we can definitely do that. I'd like to just offer out, if anybody has any other questions, to send them in. We can give it another minute, and then I guess we'll wrap this up. But I've learned a lot tonight, and I just wanted to thank you both for your time. Everyone's feedback is very important to us, so please take a moment to fill out the survey that appears when you exit the webinar. And if you don't have time right now, that's okay. We'll be sending a follow-up email that will include the confirmation of the recording availability as well as another link to the survey. Just one more question here. I had a double aneurysm. Anything I should be expecting? I'm assuming anything I should be expecting headache-wise.
Yeah. If you're not having a headache right now, if you're not having a headaches right now, that's good, and I wouldn't be expecting another one. So you do want to, if you've had more than one aneurysm, to make sure that you're talking to your neurosurgeon, that you're talking to a specialist regarding a possible vessel weakness and connective tissue issues.
Okay, good. Thank you. Well, I think that we'll wrap it up for the evening. And thanks again, everyone, for joining us tonight, and have a great rest of the week.